For me, the distinction between health and healthcare is a very personal one. We do things to people when they're sick or ill or injured that help them to rehabilitate and get back to feeling healthy. For so long, the healthcare industry has been focused on the delivery of healthcare that we don't even know how to deliver health. We've tried to assure that our providers pause to address the needs of the mind and the psychological impact that illness prevails. If you see someone as you're walking down the hall to lunch who is alone and crying in the surgical waiting room, maybe we need to pause for a moment and realize and be empathic and realize that what they're going through at that very moment is something that we're not feeling, but we can make an impact. Sit, hold their hand, even if you do nothing but listen, or maybe you do nothing but sit there. That's important. A couple of weeks ago, I was rounding at the hospital and had an opportunity to randomly walk into the cardiac catheterization lab and went to the waiting room where there was a family who was sitting there kind of upset, didn't even realize it, and just introduced myself. And they shared with me that her husband, who never could have imagined that today he had a problem with his heart. And her entire world and the world of her two children who were sitting there had changed in ways that she couldn't comprehend. And all I could do was sit and listen. But for them, that was all I needed to do. And so being present in the moment and being accountable for making sure that people have an ear is part of what we're trying to communicate across Renown Health. And it does more on the health side than the healthcare side than we could ever imagine.